Governor Ron DeSantis wants to try to keep people out of the hospital by expanding a popular treatment using a rapid response unit to deliver monoclonal antibodies to people who test positive. If you get it early enough, that treatment can really make a big difference.
This is the most effective treatment that we've yet encountered for people who are actually infected with COVID-19. This, if applied early and properly, has the ability to reduce your likelihood of being hospitalized by 70% in clinical trials.
So what it basically does is it attacks the protein in the virus to stop it from growing and then prevent you from getting seriously sick. Tampa Bay was actually one of the first places in the state to have this treatment. 10 Tampa Bay's Angelina Salcido found out what it would take to get the governor's plan off the ground.
Starting off the first clinical trials in Hillsborough County.
Because we participated in the research, we already had the setup.
USF Health and TGH doctors were ahead of the game, administering monoclonal antibody infusions to those who needed it most.
You'd stop infection, you'd stop the virus from growing, and then you'd prevent disease. And then obviously the disease couldn't turn into anything that would cause someone to not breathe, need a ventilator, or potentially die.
Dr. Kami Kim is in charge of it all. Now she's helping other Tampa Bay communities.
Unfortunately, we had a big surge here in Florida, so we've really had to expand our access to the monoclonal antibodies.
That's why the state is looking to help those that need more resources. Governor DeSantis says rapid response units will be built across the state. Strike teams will go directly to long-term care facilities to treat the most vulnerable.
Hopefully that will also provide access to people who can't get it.
Dr. Kim says the treatment will be beneficial in nursing homes and could stop future breakouts.
If one person gets it, there's pretty good evidence that you would not only help the people who are sick, but prevent the ones who are exposed from getting the infection.
Do you believe that by using this treatment and expanding the use of the treatment, that would be our way out of this fourth surge that we're seeing?
I think it's one tool, honestly. I think we need to do masking and go back to some of the safer behaviors to prevent transmission.
We got a little ways to go there. On top of helping other hospitals distribute monoclonal antibody transfusions, Dr. Kim says USF Health is also opening up mobile sites to help people who need